Today, October 20th, is National Mammography Day. It's an opportunity to stress the importance of breast cancer screenings for you and your loved ones. Here with more on its importance and breast cancer awareness event that is happening later next month is Dr. Courtney Vito with Nevada Cancer Specialists. Good morning, Dr. Vito. Thank you for being here.
Thanks for having me, JJ. I appreciate it.
Yes, breast screenings are so important. Over the past few years, I think women have gotten some changing messages, from the National Cancer Society, from the Mayo Clinic. How often should women get mammograms? What's your take?
You know, JJ, 10 years ago, I could give you a very simple answer. It's once you hit 40, you got it yearly. And that answer we found isn't right for everybody. We found that really we need a personalized approach to mammography. So for some women who we can find as high risk, that may start younger, that we start mammogramming you 5, 10 years younger, depending on your family history. And there's some women that may not need to start until later. And it also depends on the density and quality of your breast. It depends on your family history and your own personal risk factors. And unfortunately, many societies have put out general guidelines that, it is sort of a one-size-fits-all with guidelines, but we've tried to give doctors and their patients leeways to make their own decisions. I think it's very important that you partner with your physician and discuss your health history when you choose your mammography schedule.
Interesting. Yeah, so everybody's a little bit different. It sounds like the important thing is to be in good communication with your doctor about it. And the other thing is, don't ignore it. Certainly for women over 40, it's important to be aware. Absolutely.
It's really a shame if you hear a news story that says, you don't need mammography now routinely until age 50. But if you're a younger woman with high risk, that may not fit you. So really it's important to have an open line of communication and a doctor who's really well versed in breast cancer treatment as well as breast cancer screening before you make those decisions to forego routine mammography. Absolutely don't ignore it.
Yes, yes, it's very important. At your practice, you provide not just breast cancer care, but just breast care. Let's talk a little bit about what breast care is.
Certainly. So obviously when you have breast cancer, you need breast surgery. But there's some women, again, that are high risk for a variety of different reasons, and we need to start working on that. We need to start screening you earlier. Does that mean that you get an MRI in addition to a mammogram? That may be important, and that would allow us the opportunity, if you do develop breast cancer, to catch it much earlier, and that way treatment has more minimal side effects and impact in your life. Other things that we look at, with breast care, sometimes there are lumps and bumps that may not be cancer but need to be addressed or followed more closely. And then, I'll tell you a funny story. I had a patient who came to me. She was referred by her primary for belief she has breast cancer. Her mammography was completely normal, but she had these unusual stains in her bra. And her primary didn't know really what to do with it. And her mammography was normal, her ultrasounds were normal. And, I was like, yeah, I don't feel anything on your exam. And she's like, I just know. And I got an MRI, and don't you know that I diagnosed 2 very highly aggressive cancers, 1 in each breast on her, because it was her feeling. And so certainly not everyone needs a referral to a breast specialist, but when there's something that doesn't feel right about your breasts, that's what we're here for. At Nevada Cancer Specialists, we may be cancer specialists, but we're not specialists just in cancer, we're specialists in people. And when people feel like there's something wrong, that deserves a second look. Trust me, it's the best day that I have when I tell someone, I know you were worried, but I can tell you that there's nothing there.
And I have to be honest with you, Dr. Vito, every time I go in to get a mammogram, I get very frightened, honestly, genuinely. Like I get a little shaky in the lobby because I just know it's a little bit intimidating and I'm scared of the outcome. So I'm sure you deal with a lot of people's anxieties, don't you?
There's a variety of things that go on with mammography. It's not comfortable. Most of us, have a bit of modesty. Most of us don't like the tenderness that can go on with mammography, and it's really anxiety provoking. But here's what I tell my patients. Mammography is not going to give you cancer. What it's going to do is give you the opportunity, if there's a cancer there, to start fighting it.
To treat it. Early detection is the key.
Absolutely.
Speaking of early detection, there's an event coming up on November 3rd that you will be at. It's an opportunity for women to come and find out more and get in touch with breast care.
Exactly.
Tell us about the event.
So we're speaking at the Lifestyle Center West with Southwest Medical Associates, and it's really sort of a debriefing. In October, we all get inundated with information about breast cancer. We are all now very breast cancer aware, but what do you do with that information? How do you take it? How do you apply it? And how do you figure out with what you've heard how it applies to you? And so that's what this event is for. It's an open forum for women to come in and talk about some of the conceptions that they may have about mammography, about breast cancer, and their breast health in general.
And I want to jump in real quick. We just have a few seconds left, but you're also going to be giving some tips at lifestyle choices women can do to avoid any disease with their breasts. What are a few of those tips?
A few of those tips, really, once you're postmenopausal, any extra pound of weight that you carry increases your risk of breast cancer. Now, certainly there's many of us, myself included, that could probably lose a few pounds. But when you realize that that may be empowering you to prevent a breast cancer, it really takes on a more importance that we need to pay attention to. So definitely weight loss, but exercise alone. So if you exercise, even if you do not obtain what we consider a medically normal body weight, which is a BMI less than 30, just exercising alone reduces your risk of developing breast cancer.
Wow, interesting. So many benefits, yes,
absolutely.
to exercise. Thank you so much, Dr. Vito.
Thanks so much for having me. I appreciate it.
Join Dr. Vito and Nevada cancer specialist for a special discussion, Preventing Breast Cancer, What You Can Do to Lower Your Risk. It takes place Friday, November 3rd at 2 p.m. at the Lifestyle Center West at Cheyenne and Rampart. You can RSVP for this very free event by calling the number right there on your screen. Nevada Cancer Specialist has locations across Southern Nevada. To learn more, visit the website or call the number on your screen. Nevada Cancer Specialist is a proud sponsor of the Morning Blend.